This is not a case of mine, it's a case of Dr. Papadakos, but it's an interesting one to present, so I'd love to show it to you. We have a patient here presented with a a subacute thrombus in the common femoral artery. 47-year-old woman, history of heavy smoking, history of hyperlipidemia, history of cardiogenic shock, and at that time the patient was treated with an Impella device. So the Impella device was used to assist the shock care. And you know, we are in the era of large bore access, but we're also in the era of what we call small bore LVAD devices. And so these kinds of pumps are seen in practice, and one of the things that we know about them is vascular complications can occur. This patient had symptoms associated with ischemia of the leg, and then actually after removal of the device and upon an angiogram, there was fresh thrombus there. So Dr. Papadakos went and did a contralateral technique, and he crossed using a V18 control wire, put the guide wire down into the SFA, exchanged through a quick cross, and then ultimately brought the Pounce XL system in, and that is the largest device, and treated the SFA back into the common femoral artery. But what's interesting about this is there were some concerns that there was some wall-adherent thrombus, and so he went ahead and treated right on the basket wire. So the basket wire itself is an 035 wire. It's got good formidable shape, and you can really deliver devices over it pretty nicely, and it's a technique I like to do as well. And so with a balloon angioplasty actually over the wire, then performing some extirpation of clot, there was a restoration of good runoff flow down to the right leg and good relief of symptoms.